good news from Moderna today. They say their vaccine is like 94.1% effective, 100% effective against preventing severe cases. What do you think about all this?
It was only a few months ago that we really had to say very honestly, we think vaccines will work, but we're not entirely sure. So this is, another really important piece of evidence that we're seeing success from multiple fronts, multiple vendors. This is fantastic news. It's still a little bit preliminary. In other words, it's not always clear, does the vaccine prevent transmission? Does it prevent disease, or does it just prevent symptomatic disease? Is it good in all age groups? Are there genetic issues or obstacles there? Are there possible side effects that we haven't detected yet? So there's always, it takes a long time to be absolutely certain, but this is fantastic news, no question.
Should we be, concerned that this might not be as effective in the real world as it is in trials?
Trials happen in the real world, so it's really just a question of, can you generalize from your sample population? So if you did a trial in the United States, that's a particular genetic pool. Is that going to work as well in Africa? Hopefully, probably not necessarily. So that the idea of generalization, of being able to say, well, we've tested it in this one place and we think it's going to work in another place, or we've tested it with these age groups and we think it's going to work in these other age groups. That's complicated. Usually the answer is yes. You hope that it's yes, but certainly it's not good to talk about being certain of these things. And obviously safety. The effectiveness may be the same, but there may be different safety characteristics.
So I guess, my next question is, what does this all mean for Canada?
First of all, any vaccine distribution and deployment anywhere in the world makes us safer, because COVID continues to arrive in airplanes every day. So it's not just about vaccines within our borders. Vaccines everywhere is good news for everybody. So I think that's number one. Number two is, yes, Health Canada does have its own independent approval process, and that's a good thing. Health Canada's gotten some bad press for being slow, not being innovative. I'm concerned that they're holding up rapid tests and home-based screening tools. So there's some things that I think we can be quite critical about. But I think when we're talking about vaccines, which can go very badly if they're not safe, I think I want to make sure that there's extra layers of review. I'm not content just to listen to the FDA, which may be influenced by political considerations in the US. Every country has to have its own priorities and its own standards of evidence. And I'm quite content to have Health Canada do a very careful review of vaccines. And if we have to wait a little bit longer to make sure they're safe, I think that's actually worth it.
Do you have any clear picture of a timeline here when you think Canadians might be able to get a shot in the arm?
It depends entirely on the contents of secret negotiations between governments, including ours, and the drug makers. And those have not been released. For example, we don't know if we are going to be able to be licensed to manufacture locally. That would really help if manufacturing could be distributed, or whether we simply just have to line up for shipments to come here. And in what quantity. Optimistically, I'm expecting that we'll start to be able to inoculate some people in the winter, but it's going to be a long process. And we have to decide what the priorities are. You can prioritize people who are most likely to die. You can prioritize people who are most likely to spread it to others, right? So whether you go to long-term care homes or schools first, that's important. We definitely need to take care of healthcare workers, because they're and first responders. So we have to decide on that order. That's going to unfold throughout 2021. I think if I had to describe what that year is going to look like, I think we're in for a very miserable winter. I just need to be really blunt about that. I think January and February are going to be traumatizingly unpleasant. Then the weather starts to get warmer and more vaccine starts to arrive. And so just like this past summer, COVID started to retreat as the weather warmed up. That's going to happen again, but this time we're going to be adding vaccines to it. And so I think as things get better, they'll be getting better for good. And I'd like to think that by fall, by the time we're up against next year's flu season, that we'll go back to worrying about flu instead of COVID. That's my hope.